The answers are there, and certainly my background as a member of the bench and certainly as chairman of the parole board, I saw the people who were in prison who needed to have treatment and we didn't have the resources available, and if they even got a recommendation for a parole, it was usually after completion of substance abuse treatment or after completion of some kind of behavioral modification, a mental health program or something. And those programs, which were insufficient for the numbers that needed that help back in the early 1990s, are woefully insufficient now because budget cuts have required priorities or personnel within the Department of Corrections. As much as 20 years ago, the state of Minnesota continues today to have a population of their state that's much larger than Oklahoma, but their prison population is much less. And 20 years ago, we would ask the question, what is Minnesota doing that Oklahoma is not? And you could see from that point that Minnesota invested early. They invested in the community. They invested in resources before conduct led to criminal behavior. They invested so that they could intervene on addiction before crimes were committed and people were hurt and families were destroyed. Oklahoma has never made that commitment. We must. As times get rougher and as drugs become more easily made, the news stories this last week even talking about how Oklahoma's drug labs, which had gone down after some changes in our laws in the early 2000s, have now gone back up because of the ease of making methamphetamine, is destroying our state. It's destroying our population. And until we figure out how we can intervene on the people who are abusing themselves or committing a crime of addiction to themselves, where we can get them into appropriate treatment, we're never going to make any headway. Now, the ones that are selling drugs, that are making it a crime of commerce, send them to prison, because they're just spreading that scourge on the rest of our kids and on the rest of our population. But we must figure out a way. Drug courts are one way that we've been able to do it. Community sentencing activities, programs are some ways to be able to do it in communities that make it work. Mental health courts are an opportunity to intervene in other areas, but we must intervene before the criminal conduct occurs. Once the conduct occurs, we've got to be able to have more facilities like the Drug Offender Work Camp up at Bill Johnson Correctional Facility at Alva. That's a program that needs to stay the length it is. It doesn't need to be shortened to try to run people through faster, because when you do, you lessen the impact. But we need to be able to have a drug offender work camp for women in this state, where the same kind of programs and the same philosophies are used to change their behavior before they're returned and reintegrated back to their families. Sometimes people call that rehabilitation. I would tell you it's hard to rehabilitate someone who was not habilitated in the first place. We must give them the tools to be able to go back and live in their community, or give them the confidence and the resources to go create a new life, so that they don't go back to the neighborhood where they began to fall into their criminal conduct. Oklahoma can do this. Other states have done it. We have never had the political will to do it. I think it's time, and I think it has to start now.
This next question is in the category